The first noticeable contribution to Patrick's respiratory system would be his diagnosis of COPD, which is associated with his fatigue, regular cough, and dyspnea. Another major factor is his long-term history of smoking, which would have been a main cause for his COPD onset.
There are multiple factors that contribute to Patrick's heart rate being high at 155 beats per minute. Firstly, the fact that he is a 78-year-old male in itself increases the likelihood for Patrick to have a raised heart rate. Adding to this, due to his existing diagnosis of left-sided heart failure and COPD, along with his myocardial infarction when he was 68 and history of smoking, Patrick's ability to breathe effectively is seriously compromised as he has a great strain and stress that is being placed on his respiratory system, thus increasing his heart rate. His BMI is 29.3, placing him in the overweight category, which would further raise his heart rate due to strain on his heart muscles and overcompensation. Also, there is a high likelihood that medications that Patrick is on will be increasing his heart rate further as a side effect of the drug.
The most likely cause, firstly, for Patrick's left-sided heart failure would be the myocardial infarction he suffered when he was 68 years old. This may have caused damage to his left coronary artery, further contributing to the increase and progression of his left-sided heart failure. Secondly, after approximately 40 years of smoking, COPD was highly likely to become a health risk for Patrick, and that would have been the main reason for his diagnosis of the condition. There is an association between COPD and left-sided heart failure, and considering Patrick only had his heart attack at 68, the chances of him suffering from COPD beforehand is very likely, hence potentially causing a risk factor also to his left-sided heart failure. COPD causes an increase in inflammatory markers as a result of an abnormal immune response. The inflammation then further damages the airways and the lining of the blood vessels, thereby causes systemic inflammation, which leads to narrowing of the blood vessels, known as coronary artery disease, which ultimately means that the left side of the heart is overworked, resulting in high blood pressure. After a while, the heart becomes hypertrophied, ultimately worsening heart failure.
Patrick is now at an increased risk of developing right-sided heart failure. This is because right-sided heart failure mainly occurs due to both left-sided heart failure and pulmonary disease, for example, COPD. And as Patrick has both of these conditions, he is highly likely to develop right-sided heart failure. Blood accumulates through the systemic circulation, causing enlarged veins, organs, and peripheral edema. Then, blood goes into the right side of the heart, then back into the pulmonary circulation, where a patient with right-sided heart failure would experience insufficient blood flow through the lungs, causing impairment of gas exchange. This can almost be seen now in Patrick through his elevated heart rate and the fact he has left-sided heart failure, COPD, and a history of smoking, which would already be impairing his gas exchange in his lungs. It is stated that Patrick has swelling from the knees down, and with peripheral edema being a clinical feature of right-sided heart failure, this is concerning. His weight of 95 kilograms and his lack of quality exercise, as he only walks slowly, adds to his risk further for developing right-sided heart failure. Also, his sodium level is 150 millimole per litre, which is high, further adding to the situation as it shows he's dehydrated, which is another indicator of right-sided heart failure.
Patrick's blood test results reveal that his sodium and potassium levels are both high, with sodium being 150 millimoles per litre and potassium at 5.2 millimoles per litre. High sodium suggests he is dehydrated, and high potassium levels are usually related to the kidneys, but often is retested. His calcium is low, sitting at 2.05 millimoles per litre, again perhaps related to a kidney problem or his parathyroid glands and diet. He has high levels of LDL and triglycerides, with LDL sitting at 3.5 millimoles per litre and triglycerides at 4.2 millimoles per litre. This reveals that there is high levels of fat, specifically bad fat, in his body, which can further cause cardiovascular diseases. His HDL is low, being at 0.8 millimoles per litre, which is due to his diet. He also has low hemoglobin levels, which are 111 grams per litre, which can be attributed to his heart failure. Finally, his glucose levels are very high, as they are 8.5 millimoles per litre, indicating potentially a risk of diabetes, and judging by his high LDL and triglycerides, his high glucose may be due to his poor diet. High glucose levels relate to his neurological function by causing attention deficit, neural slowing, and can affect executive functioning. His sodium and potassium may affect the synapse threshold, causing muscle spasms. His low calcium levels can affect the transmission of nerve impulses and contraction of his heart, and lastly, his high levels of LDL can cause an increasing risk for Patrick in developing neurological disorders such as dementia.
A recommended blood test for Patrick to undertake would be the total cholesterol. This test combines LDL, HDL, and triglycerides to give an indication of the levels of fatty substances or lipids in the blood. It is expected that these levels will be abnormal and that Patrick will have a high total cholesterol level. This will occur because of the buildup of fatty substances in Patrick's body, which is indicated through his diet and shown through his high LDL and low HDL levels, his sedentary lifestyle, as well as his current health conditions.